And so we had a little bit of a challenge around that, educating people that our traditional foods aren't that. And that's really stepping into some tender areas, except for the fact that we then had traditional Mohawk people in the community who were still keeping their gardens and growing corns and beans and squash. We have one man who still fishes on the river and fishes seasonally, takes certain fish at certain times because that's when they're ready for consumption. Because the fats that are in those particular fish at that time when they're running is when it's meant to be eaten. I didn't know that. That guy quit school in grade 9. And here he's out. We bring him into the schools and community workshops to talk about fish and eating fish. You know, you don't have to go to the 4 walls, you know, to learn. But he lives in his classroom on the water, as his father did. And so it's the idea of promoting healthy eating, you know, around back to traditional foods. So what happens when we're regulated? What happens when we're pushed on land that doesn't sustain, you know, our gardens? When you can't, never mind eat the fish in the water, but you can't drink the water. You know, these become issues. Then you say, okay, well, we need some creativity to get around that. We're fortunate where we're located that we have access to supermarkets and all kinds of foods. We don't have the land base to run sustainable farms. And plus we're under the urban brown haze anyways. You know, we really kind of wonder how much do we really want to eat from the land that we're planting right around us. Okay, but it's the concepts. It's conveying concepts to people, okay, around that. And building a supportive environment, having physical activity for adults and families, walking and running clubs, special events that go on, special interest groups, so exercise program for men only. Because what we found anecdotally was that the men aren't going to any of the fitness programs that are on. It's all the women that are in there. Well, there are men who want to be active, and so men may go to a gym solo, and then it peters out. So we got together and got a regular fitness program going. A group of men can come together and, you know, do our own thing, as it were, safe environments. They would go out and meet the men at 5 o'clock in the morning. I'm talking about the intervention workers, and they get together with the school, the nurses and the nutritionists, and they would bring a traveling information booth to the coffee shops at 5 o'clock in the morning in the spring and summertime. And they have, they do blood testing, blood sugar testing, blood pressure testing, and they give them information on diabetes, on sunscreen. They talk about prostate exams. They go to the men and go right where they are, you know, because that's where the men get together at 5 o'clock in the morning at the coffee shops on the reserve and get together and here come these bunch of ladies in and set up their tables on. You, get over here. You know, when's the last time you had your blood pressure checked? Get! Because we also know that we don't say no to the women, especially when they do that. And so, you know, if you have to go to the mountain, you know, because the mountain won't come to you, then that's what you have to do. In promoting positive attitude, more recently we've expanded into doing work around healthy mind, spirit, and body, empowerment, looking at multi-generational trauma and relating it back to wellness, relating it back to healthy lifestyles and diabetes prevention. And if the audience is adult, it's one for their own learning, but also remembering that they have to bring that back to their children or their nieces and nephews or grandchildren. If it's for themselves, that they're role models and that it's important that they carry that healthy lifestyle with them. So these are some of the other things then that the project did in the last few years. What we learned is that there's different kinds of intervention activities, and so when we share this with other communities, we remind them, activities is not always just putting up a booth and putting out some brochures and flyers, which seem to be a very easy habit for what people would do for their job. And we got them to understand that beyond that, which is part of disseminating information, there's also opportunities where you want people to participate in events, but you also want them to experience events, which might mean a one-shot deal, or participate where they'll join a men's fitness group, but that there's also community development that goes on, and it's working with other organizations to carry on healthy lifestyle messages. All Aboriginal programs and organizations and communities pretty much have vision statements and mission statements. Would you find that? Yes. We all got vision. That's the first thing we do. And I would probably say easily 75% of them, future generation, healthy, wellness is in there. But yet, maybe when they run their events and activities, they got donuts and soda and chicken wings and, you know, all those kinds of things. So then the project started carrying on, okay, carrying on the dialogue with other organizations, saying, well, if you got in your vision that you're about health and wellness, then how come you're selling, you know, you're the NADAP program, Alcohol Abuse Prevention Program, and you have an event. So why do you got jelly donuts and you know, and soda? Where's the beer? Oh, wow, I can't have beer. Well, aren't you stuffing them with junk too? Ding! Sometimes the light goes on. And then we have to change everything. So back to that, how do we, you know, it's how do you change, you know, in reference to your question earlier, how do you change, you know, how do you get that message across? It's little by little by little. And sometimes they get it and sometimes they don't get it. Even if people are in health. Why? Particularly around the food, because food is so precious to us. Food, I think is really our ultimate addiction. You know, try and take someone's chips away from them. You know, they'll kill you. They'll give up their cigarettes and beer easier, I think. You know, try and grab that soda. And we've gotten yelled at. We've gotten yelled at by people that you're trying to take our food away from us. No, we're just telling you what it's all about. Getting out information means messages are appropriately targeted to specific groups based on age and gender. So, you know, transferring that over to doctors here and soon to be doctors here. The message has to be appropriate to your target group. You know, and one of the things that we hear back from people don't like to go to doctors. I don't know what they're talking about. One, I don't know what they're talking about. I don't understand a single word they're saying, or they don't know me. They don't know me. They come in, they look at a chart, they don't even look at me, they take some tests, and then they write this and say, here, go get this prescription. That's all, folks. And so we have to look at that and understand that messages need to be targeted specifically. You know, now, yeah, it's a big challenge. Yeah, how do I do that if I'm working in an emergency clinic or I've got, you know, 60 patients a day, you know, kind of thing. But those are the challenges then that I think that we realize that we need to address them. It needs to be content specific. One of the things we learned was you can't put every brochure on the table about all kinds of food. People just get overwhelmed. We live in an information age. You know, the messages that when you're texting, tweeting, oh, shit, you know, huh? When we're doing these things, it's just so fast. It's just so fast. We don't read books anymore. You know, collective general statement. We zoom through things. You know, look at the advertisements on television. Just look at how they construct television shows, whether it's a 60-minute thing or a 30-minute comedy thing. It's like everything is fast moving, and so messages can get lost. We had to take that into consideration, and that there's various ways of getting that information out, and doing. You have to hit the whole range. So that's what we learned about the intervention activities, the research, the outcomes here now. Okay, like I said, it's a community-based participatory research project. We wanted to train workers and researchers and get results out to people. Okay, Code of Ethics was developed in 1994-95. It took 3 months. It was led by researchers. We were about 7 people on the team, and 5 were researchers. No, maybe 4 were researchers, 3 community members. They did the review in 2002. It took them 2 years to do it. It was like 5 community members and 2 researchers. It switched. They tore it up word by word. Word by word, they reviewed the document. And what came out afterwards was so much richer than this original document, which has been internationally recognized by its use, by its adoption. But then the revised one came even richer because it put that community view on there, that cultural community view about things. And it was led by community. So what did we learn in nutrition up to 1994? On the good thing we learned from the elementary school children during this time period. We don't know if this has been sustained in 2010, 2011, but kids reported elementary school that consumed less often was candy, soda, potato chips, and French fries. And consumed more often was whole wheat breads and lower fat milk. Okay, 2% milk. And also that what was consumed more, it's not on there, was liquids with juice in it. Okay, so not 100% fruit juice, but they might have been drinking that strange blue-looking stuff that's got blueberries on it, and maybe it's got some blueberries in it. But in looking at the analysis and all, they said, well, you know what? Again, back to the small steps. You know, to go from soda, drinking less soda, and so, okay, now we're drinking fruit drinks. Granted that these fruit drinks have lots of artificial or added sugars to it, et cetera, may contain fruit juice in there. It was being recognized that this is part of the small steps that take place. Okay. On the other side, the nutrition results, we saw that fruits and vegetables were being eaten in low amounts, less than the 5 to 10 recommended per day. About 2/3 of the children eating less than 2 servings of fruit a day, and half of the children eating less than 1 vegetable per day. The school intervention staff took this and developed a program, five a day. 5 a day. And that was the message that went into all the different promotional materials and any kind of event or activity, getting children to be eating at least 5 fruits and vegetables a day. Milk was being consumed less often, which some people will say is a good thing. Sweetened drinks, here's what I was talking about, was the most popular beverage. Okay, 20% of the children in grades 4 to 6 drinking sodas every day. Okay, and the fiber intake was low. This was up to this was up to 2004. So there was take-home messages that came from each of these that they translated into activities back into the school, but again, only up to 2006. And since that time, we don't have data to see where things went. Percentage of children watching more than 2 hours, watching more than 2 hours on a school day. There were children watching too much television. See how this was with the intervention taking place, things were going down, but then you see 1999, it kind of stopped for a couple of years. When it went back in 2002, we saw that there was more kids watching TV again. So one of the things we learned here was that interventions need sustained messaging going on in there. And again, ends at 2004. So when we get back into things, if it's 2012 or 2013, it's going to be interesting to see if we end up with a whole new baseline of data again. Children not getting enough physical activity, the recommended 30 minutes per day to start. Okay, somewhere's in the middle here. And again, the peak was 1998. Okay, gung-ho, lots of kids involved, being active, and then it dwindles off again